Hi CAM followers, welcome to another one of our lives. Tonight we are joined by the lovely Karen Harris, who's going to teach us all about OCD, Osteochondrosis dessicans. I'm going to pass it over to Karen to give a little introduction about herself, if that's okay.
Well, hi Esme. So my name is Karen. I am a specialist veterinary surgeon specialising in small animal surgery. I mainly do orthopaedics these days. I work at a large referral hospital on the South Coast, and I've been there for about 6 years now. And yeah, I guess a lot of my work is with developmental orthopedic diseases such as osteochondrosis. It's certainly by no means the most common diagnosis we make, but I think there's unfortunately quite a lack of information out there, not just amongst our clients, but amongst vets as well. We don't know enough about this condition, frustratingly. So hopefully this just gives us an opportunity to discuss it a bit more and yeah, talk about what we do know and what we don't know. Yeah.
I think it's one of those things that we'll diagnose and a lot of people will hear, oh, my dog has OCD, and it sounds like an obsessive compulsive disorder. So they probably remember that, the OCD part, don't really know what it means. Other than they've got a lame doggy and they don't know what to do with that. So I think it's going to be great today. So let's get started. So what is OCD? What are we talking about?
Fine. So first of all, I think there's loads of confusion about what is the correct terminology for this. So some people will call it osteochondrosis. Some people will call it osteochondrosis dessicans, which is where the D comes from. Some people call it osteochondritis dissecans. So essentially, osteochondrosis refers to a developmental condition, so a condition affecting dogs and other species, humans, horses, pigs, etc., when they're skeletally immature. So essentially for a dog, whilst it's a puppy until it reaches its adult height and stops growing. And it is a problem of the way that their bones are developing. So we're going to have to do a little bit of biology just to help put the basics in place of how bones form. I find this really interesting, and I hope I'm not going to bore everybody too much.
No,
very childlike pictures, so nobody's allowed to laugh at my terrible drawing skills, but hopefully they will help explain briefly the process of how bones form in the womb and then in the puppy, how they grow, and what goes wrong with OCD. So if we can switch to the screen.
Yeah, we'll just disappear for a second and we should be popping up now.
Perfect. So just a little bit bigger. So this is my Fred Flintstone style bone, which is no shape that any dog bone actually is, but for this illustration it works. So when bones form in puppies in uterus, they are entirely made of cartilage. And by the time they're born, certain parts of them are bones. In this are mineralized, I should say, calcified.
Karen, I'm sorry, I'm struggling to see the image. Do you mind sharing your screen again, and we'll just pop it back again?
Yeah.
I'll just get. Sorry, guys, we'll just have a little bit of a technical issue while we get that back on again. Here we go. Hopefully this will show this time. There we go. Amanda, can you see that now? Hopefully they can. I can see it, so hopefully we're... So yeah, carry on. Sorry, Karen.
At all. So as I was saying, this is my Fred Flintstone style bone. And when puppies are in the uterus, all of this is made out of cartilage, and so it's soft and not mineralized yet. By the time that they are born, certain parts of it will have mineralized, and so actually turn to bone. And so there'll be a section in the middle here and a section at either end. And then as they grow as puppies, their bones expand in length. So these little areas here are called the growth plates or the physes, and they start expanding the length of the bone. They're responsible for increasing the majority of the length of the bone. But at the ends of the bones as well, these central areas start to expand outwards, and they also gradually mineralize. And that's a process called endochondral ossification. Now, what happens with OCD is that certain areas at the articular surface, by which we mean the joint, so for example, in a shoulder, in an elbow, in a knee, or in an ankle, which is a hock in a dog, certain areas don't mineralize as they should do. And so I've drawn it here as this little cross-hatched area. So by the time the puppy is about 6 months old, all of this surface up here should be mineralized or ossified, should be dense, should be white on an X-ray. Apart from with OCD or osteochondrosis, one little area, and usually quite a predictable area in each of these locations, fails to toughen up as it should do. Now, over the ends of these bones, where they're meeting other bones at a joint, we've got a layer of cartilage, articular cartilage. I've made it very generous here just for the purposes of my picture, but it's covering this area. And the rough idea with OCD is that if you have a little soft part of your bone here which hasn't toughened up as it should do, the cartilage that sits over the top hasn't got the right support. And so as the dog starts to weight bear on this surface, you know, the weight's coming down from the bone above, this little region of cartilage can start to sink downwards. It's unsupported, and sometimes it cracks, and in some cases it floats off, which is what I've tried to demonstrate over here. And the point at which it turns from this syndrome, where we've got this abnormal area of bone, which is called osteochondrosis, to the point where a flap develops and detaches, and it's at this stage that the dogs tend to start showing lameness. We then call this osteochondrosis or osteochondritis dissecans. So it's at this point that it develops the extra D on the end. And it's at this point that we meet most dogs with this condition, because they can go under the radar quite easily when they're at this stage. And it's when this flap comes off that the joint seems to get unhappy and inflamed. Does that make sense in a nutshell? That's what OCD is.
Yeah, absolutely. And so what sort of dogs are we looking at that would have this condition?
So we tend to pick these cases up at kind of one of 2 points in their life. So sometimes, you know, depending on the size of that fragment, we will see these dogs when they're between 4 to 9 months old. So as they're reaching the point where, you know, the end of that bone should all be mineralized, and the point at which then the cartilage has been unsupported and breaks off, you know, we can see them at that age because their joints have become inflamed. Sometimes these fragments of cartilage float into a position where they hurt when the joint moves. Sometimes they can irritate certain tendons inside the joint as well. So we'll see them in that group of dogs. Some dogs, however, will manage to get through that stage, again, under the radar. Quite often, we think, because they're often affected in both of their legs simultaneously, and a bilateral lameness, a lameness affecting either both front legs or both back legs, is much harder for us as owners and us as vets to pick up. So some dogs manage to get through that stage. They probably had some discomfort there, but it's not been so apparent. And then we'll see them later in life, by which stage, unfortunately, this damage to the joint has led them to develop osteoarthritis. And so they start with the classic signs of looking stiff when they've got up, having had a busy day and then a rest, all those types of things. So sometimes we won't actually diagnose it till they're older, but actually that condition has been there right since they were a puppy. Yeah. In terms of breeds, we do seem to see it particularly in large and giant breed dogs. And, you know, in certain cases, we see it in certain locations, we see it much more in male dogs than in female dogs, but that's not the case for each of the classic locations that we will diagnose OCD as.
Brilliant. Thank you very much. So how do we diagnose this condition?
So I guess it comes to our attention because these dogs become lame. And so it's at that age when we see a lameness in a dog that, you know, isn't responding after our usual first-line treatments for a few days of rest, sometimes a few days of anti-inflammatories. As vets, we start to have a suspicion that maybe there is a developmental condition in this animal. And there are lots of different developmental conditions out there, especially affecting well-known joints, so elbows and hips, and in which OCD can occur, but OCD can occur at other locations as well, so the shoulder or the ankle, for example. And so as vets, when we're doing our examination of a young puppy, what we're looking for as a sign of OCD, one of those signs is an effusion, so an accumulation of fluid in the joint. And it certainly takes some practice to get used to feeling for effusions. They're easier to feel in the joints nearer the paws, where obviously there's far less soft tissue, and so all the bones are much easier to palpate, and any extra fluid there is easy to feel. It gets a bit trickier the further you work up the leg. But if we've got a suspicion for this, and if the dog's telling us on examination that they're painful in a particular joint, then generally the first line for all vets, GPs and specialists, would be to start with some x-rays. Yes. And so if we, we're still sharing with the screen, aren't we? Yeah. So if I now show some x-rays, I've got some comparisons of normal legs versus legs with OCD. Can you see that okay, Esme? Yeah. So these first two x-rays are a set of ankle joints or hock joints, and we're looking craniocaudal, so from back to front. Now the left ankle here is normal. We've got the end of the shin bone or tibia here, the little splint bone or fibula down the side, and then a bone called the talus here, which you can follow the outline of. It's almost like a upside down egg box. It has two ridges, one here on the outside and one here on the inside. And just above those ridges, there are corresponding dips in the bottom of the tibia or shin bone. And the gap between those makes a very even black line. And that's the joint space. So that's the hinge point for the ankle. Yeah. Over on the right side here, we can see that grey line, again, is normal over on the outside. But when it comes to the inside, that grey line seems to widen. And it's not because the dip in the bottom of the tibia is odd, but it's because that ridge of the inside aspect of the talus is odd. It doesn't reach up as high as the one over on the normal leg did. And so whilst this doesn't quite look like my Fred Flintstone bone, it's the same kind of idea. We're missing a bit of bone that should be there. We have to remember that with x-rays, we can't see the articular cartilage. So it's not very often that we can actually see that flap of articular cartilage that has broken off. All we can see is that some of the bone, which in this stage of dog should be mineralized and should be a dense white color, is missing where it should be there. What you can also appreciate on this x-ray is the increase in the amount of gray either side of the bones, and that's the soft tissues. So it looks here like this dog has swelling, accumulation of fluid in this joint. This is an unhappy joint, presumably because number one, it doesn't fit together properly, and so that can make it a bit wobbly. And number two, it may well have a flap of cartilage having broken off because it doesn't have the support from the bone beneath.
It's quite obvious when you look at them in comparison, isn't it?
It's very easy once you know the answer, I would say. It's very easy to overlook this. But if you have a suspicion as a vet for an ankle swelling, often, taking the other leg is useful, though it is worth remembering that quite often dogs are affected equally in both hind legs. So then it sometimes helps to go back to a reference book to remind yourself of what these ridges of the talus should look like. Because it's not somewhere that we all radiograph or x-ray every day. No. Similarly, in the shoulder, this maybe looks a bit more like my Fred Flintstone bone, and this dog is affected in both of its shoulders. So what I want to draw attention to here is this is the top of the humerus here, what we call the humeral head, and the bone opposing it is the scapula or the shoulder blade. So the shoulder is a sort of ball and socket joint, not quite well as formed as the hip ball and socket joint, but this humeral head here should fit or should match with the curve of the bottom of the shoulder blade. And so here on the right leg, we follow a nice smooth curve, and then suddenly at the back, we have a little dip here. And the same over on the left, possibly a bit more pronounced on the left. We've got a nice smooth surface for most of it, and then right at the back, things become a little bit irregular and patchy. And actually in this shoulder joint, we have this extra little mineralized thing down here, which would be a bit suspicious for one of those cartilage fragments I mentioned. Now, as I said, we can't usually see cartilage on x-rays. Cartilage flaps with OCD are generally something that we just have to make an educated guess of there based on the abnormal outline of the bone. But in some cases, those cartilage flaps, if they've been there for a while, they will mineralize and become visible. And then lastly, we've got a knee joint of a dog. So this is a sideways view through a knee. So this is the bottom of the femur here, the little kneecap sat out the front, and then the tibia or the shin bone. So in this view, the head's over on the left and the tail will be out to the right. This is a normal knee over on the right. And what I want to draw attention to there is the curve of the bottom of the bone. Now, there are actually two curves, and in this view, they're superimposed on one another. So it's a bit hard to see. You can perhaps appreciate the outline of one and then the outline of the other, and both form nice smooth curves.
Yeah.
We look over to the other leg. On one side, we've got a smooth curve, but then our other outline here looks almost squared off. It looks quite irregular. I appreciate this is the hardest one to pick up. Again, to the untrained eye, you probably think I'm just imagining things, but we think there's some irregularity here.
Yeah.
Now, we tend to always take two views of a leg. So this is a side-to-side view. We take a front-to-back view as well to help us make that diagnosis. So what x-rays show us is the shape of the bones, and we're looking for irregularities of those joint surfaces. We're looking for those little divots. If we want to know about the cartilage, then we have to use other techniques. So sometimes we will inject a dye into the joint and then take some more x-rays. And the dye fills all of the joint capsule, which is the bag that exists around the joint, apart from potentially an area where there's a fragment, so it can show up the fragment that way. We are sometimes using MRI scans. That's the standard of care for people. But it requires some pretty specialist technology because the cartilage layer in dog joints is so slim compared to human joints. And MRI tends to be our most expensive test, so we don't do that too often. And then ultimately, the diagnosis of the cartilage flap will sometimes come from what seems more like a treatment option. So having a look physically inside the joint, either with arthroscopy, which is keyhole, or with arthrotomy, which is making a small hole in the joint and physically being able to look with the naked eye.
Yeah. And I just wanted to go back to when you're talking about the little bone fragment.
Yeah.
Can you talk a little bit about what happens? Because we have a very cute name for a very horrible thing that's going on, because they're called joint mice, aren't they? Joint mice.
Exactly right. So these fragments of cartilage, when they detach, how big an influence they have, we think depends to some degree on where they go. So first of all, they are thought to, in all cases, cause irritation to the joints because they release little chemicals that cause inflammation, what we call a synovitis. But from that point onwards, then they can cause a greater or a lesser problem depending on where they lodge. So in the shoulder joint in particular, there is a little pouch to this bag that we mentioned, the joint capsule that sits around this joint containing the fluid that acts as a bit of a lubricant. And if that fragment ends up in the pouch back here, it often doesn't cause too much of a problem. And some cases, if the fragment's down here at the time that we've made our diagnosis, we actually decide there's not much merit in us going in to fish out this little fragment, which, as Esme said, gets the affectionate name of a joint mouse. However, sometimes the fragment goes to an area where it is more of a problem. So, for example, down the front of the shoulder here, we have the tendon of the biceps. So it starts from the shoulder blade and runs in a little groove down until the main bulk of the muscle sits over the humerus, just like it does in us. And if that little fragment gets in and around that tendon, it can cause irritation there. So yeah, the fragments, you know, and again in the hock, sometimes those fragments will be attached to some of the ligaments in this region and cause an irritation that way. So they can, just by their physical presence as well, cause a kind of grating sensation or irritate tendons and such that reside in some of these joints.
Yeah. So what are our options then in terms of treatment?
Well, the first thing to say is that we don't absolutely know what the right thing to do is. We've not got enough evidence. What we'd really like, you know, is a big study with lots of dogs who have very similar degrees of severity of OCD, and to allocate them randomly to different treatment groups and to follow them for a long time and see how they've done. And unfortunately, that's just so hard to organise in veterinary medicine, just trying to find, first of all, that same number of cases. So our information has come from experience, I guess, in orthopaedic surgeons over the years thinking, well, maybe it will help if we take these fragments out. Let's see what happens then. There are some studies out there as well. We always look to what human surgeons are doing for humans with OCD as well. I guess the one option is that we do nothing, and certainly in the group of cases I mentioned that we don't pick up until later in life, perhaps, for example, like this dog here, we would maybe choose not to do surgery because we think, number one, his fragment's in a place where it's not causing him any bother back here. Number two, if he's an older dog, it's quite possible that his discomfort now is more associated with the development of osteoarthritis, for which surgery, you know, to go and poke around in his joint and such isn't going to help him. And so we would start him perhaps on multimodal management of arthritis. So considering whether various forms of kind of dietary modification, exercise modification, physiotherapy, hydrotherapy. I'm sure the things that the CAM followers are well versed in. There's certainly, as I said, this group of dogs who we wouldn't consider surgical candidates. And there are some young dogs as well who we wouldn't consider surgical candidates. So sometimes we pick up these lesions as an incidental finding. So, for example, if a dog were having an X-ray of its chest, because it developed a cough, we might spot a small irregularity in its humeral head, for example, because the humerus happens to be caught on a picture of a chest. But if that dog was completely asymptomatic, then again, it's a hard argument to go and start poking around inside a joint, because there's always the worry that we're going to do more cartilage damage than already exists. Certainly, there is a real spectrum of the sizes of these lesions, and it is reported in some cases that they can, to some degree, heal of their own accord. They don't always end up with a cartilage flap detaching and becoming a problem. So if the dog's asymptomatic, the lesion's small, and we've picked it up just as an incidental finding, we probably wouldn't do anything.
Yes.
The next rung on the ladder of treatment tends to be, excuse me, us thinking about essentially going in to fish these fragments out. So especially if our suspicion is that the fragment is probably maybe still semi-attached to the bone and is flapping around, or is somewhere where it is causing a problem. So dogs that come to see us, again, between that 4 to 9 month age group, who are lame, who are responding to us moving that joint, and who have consistent findings on their imaging, we consider it perhaps beneficial in those cases to go and take that fragment out, because that fragment then can't keep getting in the way of anything. It can't keep eluting these inflammatory mediators. And so we will make a small approach to a joint, as I said, either with keyhole surgery, with arthroscopy, or by an arthrotomy, making a small hole and going to fish that fragment out.
Yes.
Now, the response to that seems to be quite different depending on which joint you do that in. So it seems to work very nicely in shoulder joints. We often see a really good improvement in the dog's comfort if we go in and we fish that fragment out. Yeah. At the same time that we fish that fragment out, what we want to do is anything that we can to promote healing Now, disappointingly, once that articular cartilage fragment is gone, this little red bit here, there is nothing we can know of that we can do to get that same type of cartilage to come back and perfectly fill in the divot and resurface this joint, which is what we really want to try and stop arthritis developing. All that we can really hope for is that the body fills it in with a different type of cartilage, which is not quite as good, but it's certainly better than nothing.
Yeah.
And to promote that, to get that to do the best healing possible, there is a theory that suggests you should make some little holes in this area here, drilling down towards where the bone marrow is, because this area we think hasn't got a very good blood supply. I think that's what went wrong in the first place. Yeah. And so if we make little holes with a tiny little drill or a tiny little pick, then it gives chance for stem cells from the blood, from the bone marrow, to get up to this surface, and that might give us better healing. So that's one treatment option, to fish out the fragments to promote healing by essentially making lots of tiny little holes in the area that's abnormal. Yeah. As I said, that seems to work well in shoulders. Disappointingly, it's not so effective when we're dealing with ankles or hop joints. Mm-hmm. Probably because whilst with the shoulder lesions, it's often quite a small area relatively of the shoulder that's affected, and you've still got a good proportion of the articular surface that is normal, and everything still feels very stable for the dog in that shoulder. With that ankle joint, the bit of bone that's missing, that projection here, is quite pivotal to that ankle joint being stable, just bending and straightening in the direction that it should do. So part of the lameness in the ankle, we wonder whether it comes from not just the lack of the nice articular cartilage in this region, but also the fact that you haven't got the interdigitation between the talus and the end of the shin bone here. And so you could take that fragment out, but disappointingly, you know, even if that does fill in with that secondary type of cartilage, lots of these dogs will still remain somewhat lame or go on to develop arthritis really at a much younger age than we ever consider, you know, the norm. Yes. And therefore often other treatments are required subsequent to that. So it does vary a little bit on where in the body the OCD lesion is, as to number one, what treatment we offer, but number two, what outcome we kind of expect and explain to our clients as well.
So in a good case of, let's say, a shoulder joint where you've done surgery and it's done well, do we still expect that dog to be more prone to having arthritis going forward, or not?
Disappointingly, yes. I think we know that any trauma to a joint or any developmental issue that means that you have lost articular cartilage, and that for some period of time you've had inflammation, this synovitis in your joint, we can be pretty sure that ultimately you are going to develop arthritis there, and develop it sooner than, as I say, we would expect, than compared to, say, you know, with normal wear and tear on a joint. So perhaps, you know, none of us would be surprised to find a little bit of arthritis on an X-ray in a 15-year-old dog who's had a very active life, but it's much more likely to be the case that we would pick up evidence of osteoarthritis in a 5-year-old dog that had OCD as a puppy, even if the fragment was taken out promptly. So disappointingly, you know, even where I'm saying this, you know, for certain joints like shoulders, they seem to respond nicely. We do hope to get the dog sound again. That we still know, unfortunately, that osteoarthritis is coming, and so we still tend to make recommendations as to how the owner of that dog can then manage that dog as best as possible to minimize the progression of that arthritis and to minimize the impact of that arthritis for the dog as well. So harking back again to my old favorites of, you know, weight management, hydrotherapy, physiotherapy, all those types of things.
Brilliant. Before we carry on, have you finished with your pictures? Shall I pop up now? Yeah. I'll just pop my screen back up. Hi everybody. So we've talked a little bit about prognosis, and really, I guess in any instance of a dog with OCD, we are expecting arthritis at some point. It's just trying to get in early enough that we give them as long without it as possible.
Yeah.
Is there any way to prevent it? Is there preventative measures?
To prevent OCD, you mean? Not that we know of. You know, there are certain things that have been proposed to be risk factors. So I think, number one, we think to a degree this is heritable because we see it so much in particular breeds and in particular bloodlines. The problem is it seems to be complicated genetics. You know, it's not as straightforward as the parents have it, so the puppies will definitely have it. There seems to be lots of genes involved in the puppy ending up with it. We should be trying to raise awareness. So I always do encourage owners of puppies that are affected to feed that back to the breeders. It's not a blame game at all, but, you know, we should be striving to try and breed from dogs without the causative genes. The problem is we just don't know exactly which the causative genes are to be really specific about that at the moment. In terms of whether environmental factors have caused it, has something, you know, prompted those genes to be expressed and to manifest as OCD in this particular puppy. There have been lots of suggestions. So some people wondered whether it's because our large and giant breed puppies grow so quickly that maybe something's going wrong with this process of endochondral ossification, the normal turning of cartilage precursors into fully mineralized bones. So there was a theory that, you know, our big dogs were growing too quickly, and maybe that was being accelerated by the fact that, you know, we all want to feed them really good diets. Maybe we were giving them, you know, too much of certain minerals and such. But nobody's been really able to conclusively prove that. We know that diet can have an effect on endochondral ossification, but we don't know for sure that diets lead to this specific problem with endochondral ossification, so with OCD. So unfortunately, I've got no specific, like, steer clear of this diet advice. You know, hopefully more research will help us, you know, work out whether there is anything in the diet idea. But at the moment, I think the counter argument is that if it was a problem with our puppies growing too quickly, or with, you know, us giving them too much of a certain nutrient, why is it that such a specific area of these joints gets affected? You know, why shouldn't it be that their bone growth goes wrong all over? You know, if they're growing too quickly and putting too much weight on their bones that aren't yet mineralized, that should cause a problem, you know, all over the joint surface, not just in particular areas.
So we see sort of those developmental conditions which are associated with malnutrition in the way that they've had too much of one type of micronutrient or whatever it may be. And we're not seeing that with OCD. We don't tend to have them everywhere over the whole body.
It's really, really predictable locations in each joint. And I think the shoulder is a really good example in that, you know, they've actually done studies to look at which part of your shoulder as a dog takes the most weight. And it's not the area where you get OCD. So it doesn't really make sense that way. In the same vein, there was a theory that maybe it's a result of trauma. They did some horrible experiments dropping piglets from a height to see if, you know, repeated impact were leading to them getting OCD lesions. But again, they couldn't really prove it. It caused problems. You know, it did seem to increase the number of piglets that were presenting with osteochondrosis, dessicans, but maybe that's just because the trauma caused their cartilage fragments to break off. It didn't actually cause the problem with the endochondral ossification to start with. So again, people have said, is it the case that we're doing too much exercise with our puppies? And lots of clients say that to me as well. They're so worried that they've caused this. And I say to them, you know, there's theories about it, but there's at this stage no strong evidence to say that, you know, you should be doing this much exercise or you shouldn't be feeding this diet. We just don't know, frustratingly, other than, you know, a fairly strong suspicion that it's genetic. So no, frustratingly, little we can do to prevent it, other than perhaps push for a better system of reporting these cases. And again, not in a blame way, not in a like this breeder's had this many, but just trying to pick up whether we've got a repeatable problem in a set bloodline, and trying to selectively breed to get puppies without this condition.
Yeah, I suppose the amazing thing would be to have almost like the HIP scoring system where we can look and see genetically what's the most likely to happen, and we're not quite at that point yet, but that would be the dream, wouldn't it?
Yeah.
Going back to your point before, Nicola just asked, do you make any recommendations to owners of young dogs with respect to nutrition with or without surgery? Obviously, we don't think there's a specific cause, but is there something you would recommend in terms of nutrition for a dog who's had joint problems?
Personally, I'm a big fan of the joint-specific diets that are out there, based on, again, fairly limited evidence, but actually some nice evidence, the type that we always want, the type where the owners don't know and the dogs don't know and the vets don't know which type of food they're being fed. And there was one good study where the dogs with arthritis who were on a joint-specific diet seemed to really benefit from it in terms of it minimised their outward signs of osteoarthritis. So yeah, I do tend to recommend joint-specific diets for dogs that have this diagnosis, and ideally to get them onto that food and then eating that food for the rest of their lives. But I do stress to clients that it is one of those diets that to get the maximal benefit from it, they really need to be eating that diet and just that diet. I spoke to one of the food reps the other day, and she says, oh, I let it slide and I say to people they can have, as long as it's 90% of the diet. And I say, no, I'm stricter, because there'll always be, the 10%, they just hoover up off the floor. But really, unless you're prepared to feed that diet and just that diet, you are throwing your money down the drain, because it is more expensive than, generic dog foods. But I have seen some really good successes on it. I think the bigger thing for me, though, is just weight control. So I would much rather you fed any old dog food, but your dog was on the slim side of normal, than you worried about trying to afford, joint-specific diets. Or, some dogs just can't have those diets because they've got skin allergies or dietary intolerances or anything like that. So the bigger thing for me is just slim side of normal, and I go on about it until I'm blue in the face.
Yeah, you've probably seen from Cam that we're obsessed with weight management and not slip floors. They're our two favourite things. So we've got a few questions I'm just going to run through with you. This one's from Anna. Her English Cocker Spaniel was only operated on last September. He was almost 9 years old. He limped with his left front paw. He has OCD in both left and right elbow, and he has now arthritis in both elbows. He's got a tailor-made brace on his left elbow. Is it better to consider a brace for his right front paw too? Tricky.
It's really tricky. I guess one thing we know with OCD in the elbow is that it's not uncommon that we also pick up that they have other aspects of elbow dysplasia. So this umbrella term that we use for lots of individual conditions of the elbow that again are developmental in origin. So they've started when the puppy was very young. So I'm not sure about your boy, but it's possible he had this and he coped very well with it until he got a bit older, and now the arthritis has caught up with him, and he may have more than one thing going on. With a brace, it can, give them some support if their elbow joint has become unstable at all. There's a counter argument that says that maybe kind of limiting their motion might mean they get a little bit more muscle atrophy. So it's a really hard thing to pick between. And I think the most important thing with braces is, as you've acknowledged, that you often really need to go down the tailor-made route, because generally dogs and shoes or boots do not make happy bedfellows. They are all such different shapes that trying to buy something off the shelf that fits and offers support is a really hard thing to achieve. There are lots of nice, soft, neoprene or glorified kind of tuber grips that, of course, fit very well but don't offer much support. And then, so to get proper support, you need a really snug fit. but if it fits in slightly the wrong way, it's very easy for them to then get sores and rubs. So I think if you were going to go down that route again, I think probably take some specific advice from whoever saw him for his elbow diagnosis, and probably again it would have to be tailor-made if you were going to go down that route.
Yeah, I mean, there's some very good booties and things out there just to help with not slipping around, but it's a different thing when you're talking about actually trying to support that joint, isn't it? There was a very a really good live with Diane Messam, and she did all about braces, so that might be one to go and have a look at about that. Harmony has asked, when young dogs are diagnosed with OCD and undergo surgical treatment, and after rehab the owners want to carry on with training for dog sports such as agility, how should they be advised?
So I guess, as I said, it depends to a degree on which joint is affected, and I would be a lot more positive about things for, say, a shoulder lesion than for a tarsal lesion. But I think I always just say to people that we have to be guided by the dog. And generally our agility clients are brilliant at picking up when the dog's not on form or uncomfortable, often much quicker than I think I'd be able to pick it up when I get to just watch them in the car park, walking up and down. So I think my general feeling would be, it's absolutely reasonable for that to be your aim, but we have to be guided by the dog. If we're finding that they go to a training session and they're, not many will pull up lame in the session because the adrenaline's running, but that they're paying for it obviously that evening or the next day, then personally, I think unfortunately that's not the right thing to be proceeding with. We do really want these dogs to stay in condition. We don't want them to become couch potatoes and such, because that's only gonna make things worse for their joint. They really need good muscular support, kind of encouragement and range of motion. But it, of course, it is a big ask doing kind of full-on agility of a joint that's imperfect, and it may well be an aggravation for a joint that, of course, still doesn't have a perfect surface covering of articular cartilage.
Yeah, they'd have to be realistic about what the dog's actually long-term going to be able to achieve, unfortunately, wouldn't they? Yeah. Jean has asked, how successful is surgery for elbow mice?
Unfortunately limited, I would say. The elbow joint in a dog seems to be one of the most unforgiving of having anything amiss in it. It seems that we can go in and take out fragments, be it that have arisen as a result of OCD, in which case it tends to be the bottom of the humerus that's affected by OCD. More commonly, fragments in the elbow are the result of a part of elbow dysphagia, a condition called medial coronoid disease. And, a common treatment for that is keyhole treatment to remove the fragmented coronoid. But again, our problem is the same, that we're fishing out these fragments. We use the analogy of taking a stone out of your shoe. It seems to make a proportion of dogs more comfortable in the short term, but the problem is the blister that you've left behind. So that lack of articular cartilage, be it covering the bottom of the humerus in the case of OCD, or covering the coronoid region in the case of medial coronoid disease. And so disappointingly, we do see arthritis progress still, despite us fishing out fragments, even when we, feel like we've got in there really early with dogs and elbow mice. So limited, I'm afraid to say.
Yeah, it's difficult. I think the elbow in general is our least favourite joint for arthritis because it's the hardest one to try and manage, isn't it?
It's so upsetting. I wish we had a good solution for it. I really do.
Maybe one day, hopefully one day.
One day.
What are your thoughts about supplements? So Sandra's just asked that she's got a dog who's ruptured both cruciate ligaments, and she's just asking what your opinion is on giving glucosamine chondroitin and MSM.
Oh, the jury's so out, isn't it? For every paper that I read that says, yeah, you give them, they work, I read another one that says they don't do anything.
Yeah, I'll give you a little standpoint from Cam. We tend to say, if you've got, so we talk about things that are beneficial, and then things that are potentially beneficial and are going to do no harm, and then things that are potentially beneficial but might do harm, and then you've got things that aren't beneficial. And supplements kind of fall in the potentially beneficial probably not going to do any harm, depending on what the supplement is. So some of these things, herbal medicines and things, you do have to be a little bit more careful with. Things like turmeric they're not benign. You still need to be careful of what you do. We always say with things like chondroitin, glucosamine, MSM, feel free to give it if you want to, if you have the funds for it, but don't use that over other things that we know definitely work. Out of all the supplements, we've got the best evidence for giving omega-3s, and that's from a marine source. But otherwise, the CAM advice in general is we're not against supplements. We just make sure that isn't where the funds, the pot of money you've got for your dog's treatment isn't going purely on supplements, when we know there are things out there that can be more effective.
I could agree more.
To that, Karen?
Yeah, no, absolutely. You know, I've been told so many anecdotal reports by owners saying like my dog was a new dog on them, that like I wouldn't discourage anybody from trying it. You know, I've yet to, touch wood, see a dog that has had, you know, ill effects from having one of these supplements you mentioned. Glucosamine and chondroitin are probably the most well known. But equally, they are supplements. They're not medications. Nobody's had to prove that they work. And some of them are marketed very well and are very expensive. And again, they may be doing nothing. So yes, if there's the budget for them, then absolutely, as part of kind of multimodal treatment, you know, following the inevitable onset of arthritis that we see with cruciate rupture, even when it's, you know, treated really early and treated really well. Yeah, I think you've summed it up really well.
Thank you. What else have we got here? So yeah, so just again, Sandra just talking about slippery floors and then thanking you for answers. So I'd like to ask you, in the case of I guess we've talked about the fact there isn't really preventative care for OCD lesions, but for an arthritic dog or a dog that's maybe had OCD and we know is going to go on in the future to have arthritis, what are your sort of top tips for that owner to sort of take their dog forward into the future and have the happiest life that we can give them?
I tend not to be too prescriptive with exactly how much exercise they're doing, because it's so variable dog to dog how their arthritis will progress, how quickly it will progress. We have no good way of measuring it either. So I could take x-rays every year of that dog that has had an OCD lesion and perhaps had a fragment removed in the area, drilled to try and promote healing, and it wouldn't actually get me much further forward. It's much more important to go off what the dog's telling us. So, you know, looking for those classic changes in behaviour, that perhaps on a walk they're not running around as much as their, you know, equally aged, equally sized littermate is, or doggy brother is, whether they're sitting down, whether they're not wanting to kind of rough and tumble, whether they're retreating from that, whether they look stiff when they first get up after rising. So I tell owners that we need to strive to find a happy medium. You know, it would be no good for these dogs if we wrap them up in cotton wool and never let them, you know, walk or run again. We've got to find, you know, some happiness for them doing their favourite thing, having a run around, etc., but just not to the point where they would then really pay for it after, because they don't have the same cause and effect reasoning that we do. You know, at the time chasing their ball, they do it for an hour, it's the best time of their lives. They're not going to associate that later in the day they're going to really pay for that. So I don't tend to set out like, you can do this much walking, you can do this much on the lead, but I try and kind of just signpost to people what they're looking for and how we might try and achieve that. So making sure that the dog's warmed up first, so often doing a portion of the walk on the lead first, letting them have some time running around, but trying to pick, you know, suitable surfaces like flat grass fields rather than kind of sandy beaches, bogs, anything like that. Just again, just trying to strike a balance really, where they've got still really good quality of life, but that we're looking after those joints, trying to make changes in their lifestyle early. So many of us start off with rules for our dogs that they're not going upstairs and they're not going on the sofa. And I don't mean to be the baddie that says your dog can't do that. But, you know, at some point, unfortunately, your dog is going to find it much harder to safely get up and down the stairs. And things like jumping off the sofa are really going to impact those joints. So if we can get them out of the habit of that when they're young, it's, in my opinion, better. And you can go and have a cuddle with them on the floor. But you know, we're going to have to stop it at some point. So my argument would be, you know, especially when I'm meeting these dogs at between 4 and 9 months old, try and get them used to not doing those types of things to start with.
Yeah.
So yeah, that's exercise. Weight, can I talk about that again? There are so many overweight dogs out there that it's almost become the norm. You know, I borrow a friend's Labrador, and like, people regularly tell her, my friend, that her Labrador is underweight, and it's not, it's perfect. We've just all become used to seeing a nice roly-poly Labrador, who are very cuddly, I agree, but it is doing no favours to their joints. So I'm very strict on making clients promise me that they will always keep their dog slim. As I said, there's more evidence for the joint-specific diets than there are for the joint supplements. So if finances allow, I say go for the joint-specific diets and knock the supplements on the head. If your dog can't have a joint-specific diet, then by all means try the joint supplements. And then picking appropriate exercises alongside physio and hydrotherapy if there's, you know, room to do that on a regular basis. We really want to not get in the vicious cycle where their joints hurt, so they stop using their joints fully, and so they lose muscle when their joints stiffen. So there is a lot of kind of proactive stuff to be done, rather than waiting to the point where we think, oh no, arthritis has become a big problem now.
Yeah.
And ultimately then I do warn owners that there is the potential that in certain cases, and perhaps I'm more talking about the dogs with OCD in their hocks, in their ankles, that because it's fairly likely that their arthritis will catch up with them far sooner than we'd expect, and perhaps to the degree where all of our more hands-off measures aren't going to be enough, that in some cases we do have to consider a second surgery at kind of middle age, which might involve something somewhat more drastic. So considering joint replacements, joint fusions, something like that, to try and get these dogs out of pain. So unfortunately, some OCD cases do come with the warning that we would look maybe to do more if their arthritis becomes a significant problem for them, and we can't manage that in a hands-off manner. The reason that we don't leap into these bigger surgeries at the outset is that they, number one, they don't always restore function. So a joint fusion gets rid of pain but leaves you with a fixed, in case of a tarsus, a fixed ankle, so like wearing a ski boot all the time, which obviously has a bit of a knock-on effect on the rest of your joints. In the case of joint replacements, one problem is that, you know, other than the hip, joint replacements are still relatively in their infancy in veterinary medicine. I wouldn't say they're absolutely tried and tested, so they do come with a reasonable list of risks. And if we get complications, those complications can be very difficult to sort out. So they have their place for sure, but they're not something that we leap into lightheartedly.
Yeah, definitely. And I'm just going to add in one that Lynn's added. She's just said to stop dogs jumping in and out of cars, because that's another one.
Please, I would say that on that note, I love it when clients come to me and they say, I bought a ramp, but then I have to really encourage them to stick with it. There is something about most dogs and ramps that they do not go together. They just don't know. And it generally takes 3 people, one either side of the ramp and one with the treat at the top of the ramp, and doing that quite repeatedly to get them used to it. Otherwise, I find they take one look at this ramp and then leap out the car anyway. So if you buy a ramp, you'll be your vet's favourite person, but persevere with it. Know that they, for some reason, it just must feel really alien to them to get used to it. But again, something really worth doing as a young dog, because then they will keep doing that through their life. They'll have avoided a lifetime of that high impact jumping down. And should they, you know, become really arthritic as an older animal, you've then got it easy. You know, your dog already knows how to go up and down
the ramps. Yeah, definitely. I thoroughly enjoyed this evening, Karen. Thank you so much for joining us. I feel like I've topped up my own vet knowledge and hopefully done a little bit of CPD myself, so I know what to do next time I have a dog or I'm suspicious of OCD. I think it's one of those ones where I think this is the one condition where it's really important that when you've got a lame dog who is young, that you do go and see your vet and you don't just ignore it as a strain or something, especially if it's going on for longer than a couple of days, because it's so important to try and get in there, one, early, and two, then know what your future might be with that dog, because it's being realistic with your expectations with them. And it is a horrible disease. And as you've sort of highlighted here, we still don't have we don't have a cure, we don't have some miracle, we just have ways to manage it as best we can. And I think that's, as far as I know, the same in human medicine as well. There's not some magical thing they've got that we haven't yet got access to. It's a case of just doing what we know. So so thank you very much for joining us.
Yeah, absolute pleasure. I was going to say the only thing that they're trying to do a bit more in people is to consider what they call joint resurfacing. So either borrowing bits of essentially joint surface, so again that bone topped by that articular cartilage, and taking it from one joint in that dog and putting it into this defect in a human, and putting it into a different location. And we have started to do that in veterinary medicine as well. People may have heard of a system called OATS, or there's using fake essentially blocks of bone and blocks of fake cartilage to put in something called Synacart. But again, still in their infancy. But hopefully, things are developing all the time as we get more cases that have gone through having had these procedures. Hopefully, we will have a better solution. But yeah, exactly as you say, with a young dog, it's a horrible diagnosis, and I hate making it because I don't have a great solution. But information is power. Even if you just know that your dog has this diagnosis and how best to manage your dog, you can potentially make a huge difference to the outcome for your dog with OCD, rather than it going under the radar, being a chunky roly-poly Labrador, eating wrong foods for its life, and then, being hit by the resultant osteoarthritis at a disappointingly young age.
Yeah. Well, I'm so grateful to you for your time. Thank you for joining us. Thank you to everybody who's listened tonight, and hope you've all enjoyed it as much as I have. And we hope you'll come and join us again soon for another topic that we can pick your brains about. Thank you for giving it your evening.
Brilliant. Thanks, Esme.
Good night, everybody.